Hello, good afternoon, and namaste. It's lovely to see all of you at the COVID Care series presented by the Apollo Hospitals. This is Dr. Srinidhi Chidambaram. We at Apollo send you all our best wishes that you stay well and healthy during this COVID-19 pandemic. Awareness is key to good health and well-being. Knowledge is the one thing that can lead us from darkness to light. And that is what is needed at this time, to get rid of the dark space that we are in today, surrounded by rumors, misconceptions, and distressing news, fear, and stress. What we need now is relevant and authentic knowledge and awareness. So this is what we've been bringing you every day as part of our COVID Care series, with information that is not just about COVID-19 in general, but every aspect of our life and health that this disease and pandemic has affected. One aspect of COVID-19 is muscle and body pain. It's a common symptom, not only in COVID, but in most viral infections, even like the flu. It will pass off, but while it is there, it can be very distressing. We also need to be aware on how to differentiate the viral body pain and muscle ache from joint pains and other orthopedic and autoimmune arthritic conditions. They also can cause joint pain because of inflammation. As for people who have pre-existing musculoskeletal problems, how do they manage COVID-related aches and pains? If they get COVID, what should they do? What about their routine treatments, physiotherapy, follow-up, or even scheduled surgeries? Should they be postponed during the pandemic period? To discuss all this today, I'm very happy to welcome Dr. K Kosygan, Senior Orthopaedic Surgeon from Apollo Hospitals, Chennai. Dr. Kosygan is experienced in advanced orthopedic surgery with an experience of over 21 years in the specialty. A university rank holder in surgery, he holds an MCH, MSc, FRCS, and he also has an expertise in a range of complex orthopedic procedures. Dr. Kosygan is Senior Clinical Fellow, Southwest London Elective Orthopaedic Centre, Epsom, UK. Also a Lower Limb Surgery and Research Fellow, Musgrave Park Hospital at Belfast, Northern Ireland. Associate member of the British Orthopaedic Association, member of the British Orthopaedic Training Association, the British Association of Computer and Surgery, and the American Association of Orthopaedic Surgeons. Dr. Kosygan, it's great to have you here today in our COVID Care series, and I hope that we will be able to help our viewers to tackle all the aches and pains with or without COVID-19. Over to you.
Thank you, Dr. Srinidhi, for the nice introduction. And yes, I think in this pandemic, one of the common things we see is also about panic and distress about some of the news we see. And compared to last year, same time, where the initial symptoms of this COVID-19 viral illness was mostly directed towards fever, sore throat, and then later on it came that even lack of smell, lack of taste also was recognized as one of the symptoms of COVID-19. Later on, if you see in the last few months, there's also increasing reports about muscle aches and joint pains are also recognized or one of the symptoms of COVID-19. So there's nothing to panic about it because, like you earlier mentioned, any viral illness we know can cause body pain, and with or without associated without other symptoms, or sometimes in body pain alone. And so is COVID-19 also. When you speak to someone, and some patients have called me and also the doctors, that the entire body is hurting, like anything. It's gonna float them down. They have to take rest for 1 or 2 days, but not necessarily any other associated symptoms of COVID-19, such as cough or fever. When you actually probe them, however, they do tell that it is only the last couple of days, And like you mentioned, how do we actually differentiate this from a body pain which they could have developed from some of their activity related, or could this be a viral related illness, and could this be COVID-19? Certainly, the history forms a major part of that. So when we get calls from that, from our friends or patients who want to know they got body pain, muscle pain, which they've never experienced before, sometimes that's what they say. It's a body pain or ache they've never experienced before, and it's only in the past day or two. And sometimes when you ask them, they do say that the body felt warm, but they didn't actually check the temperature. Now that's very common. When you ask them whether do you have any fever associated with that, sometimes the answer is no, because they've actually checked that. But if you ask them, they say, yes, there was a bit of warmth. And the next thing, of course, is to also ask, do you have any other symptoms? And sometimes in 30% of the cases, it may present only as body pain or joint pain and not necessarily with any other associated symptoms. And we also, then the question we ask them or how we go about it is ask whether they have, from their knowledge, have they been exposed to someone with COVID-19 in the workplace or in the surroundings or within the family. Now, sometimes if the answer is yes, then most likely the sudden onset of body pain, muscle pain is possible that it could be due to COVID. And we tell them, please get it checked, because one is to quarantine them, and two is also watch them and observe them for any other associated symptoms which may develop in the days to come, and also treat the pain. Now, the virus, we know that virus can cause myalgia or muscle pain. How it actually causes this, it can be in two phases. One is what we're talking about is the sudden severe pain, acute pain. And we also have in viral illness and also in COVID, now the specific term which has come to is like the long COVID, which is even months or weeks after someone has gone through a viral illness and this COVID also, they continue to exhibit or they continue to experience the symptoms of fatigue and intermittent headache, and the joints still ache. They don't feel that they're actually back to normal. Now that is the long-term effect of viral illness, what we call the post-viral. If it's joint, it's post-viral reactive arthritis, which is well known even with the previous viral illnesses like dengue and chikungunya, which is so common. Sometimes people themselves identify and come back and tell us they've had chikungunya or dengue before. Could this be related? Yes. So one is the acute thing, whereby any virus which enters our body, we know it triggers the immune system, and the immune system then releases the cytokines. The cytokines causes inflammation in the muscles and sometimes in the joint. So this usually, in most cases, will last only during that acute period where they also experience fever and other symptoms, and gradually as they come out of it, they recover from it. And during that phase, symptomatically, they are treated with analgesics and sometimes anti-inflammatory. Now, the other phase is what sometimes, in fact, so much so when patients come back and tell us, sometimes they are branded as, oh, this could be psychosomatic pain, because there's nothing else to find except that the patient is describing they're fatigued, they're feeling lethargic, intermittent headaches, they're not able to stay focused. And these are called the chronic fatigue syndrome or post-viral. There's several terms which have been coined or given to that. And finally, mostly in the West, the UK, US, everyone now have narrowed down to call this as a chronic fatigue syndrome or post-viral encephalitis or myalgic encephalitis. It is not in true sense an encephalitis. So that actually is a bigger challenge to treat with. Because it goes on for weeks or months, preventing them from returning back to the activities they want to, and sometimes it makes them depressed. So that group of patients do need assessment. And how do we assess is, again, history, examine their joints, and then do some investigations to check structurally as the viral infection or any illness they had, has it made any damage to the tissues in a permanent way? If not, the mainstay of the treatment is to reassure them, and importantly, getting them back into a graduated form of exercise. Because what happens is a lot of us are not used to staying or taking rest for more than 2 days. So sometimes this long, the long term or the long sequel happens is because in the acute period, I would recommend you do take rest, adequate hydration, and of course some supplements. And of course, complete rest is not good either. Even if you're quarantined at home, if you're confined at home, we encourage that you do exercise in moderation. Because why we say in moderation and not in excessive, because in COVID-19 particularly, the other aspect is the hypoxia or a low oxygen saturation state. Now, when you exercise excessively in a low oxygen saturation state, your metabolism which is supported by good oxygen supply to the cells turns into metabolism where the oxygen is not enough for the cells, what we call it as anaerobic metabolism. Now, in anaerobic metabolism, what happens is the lactate levels goes up, and this lactate is not good. It causes acidosis, and it can further enhance your pre-existing arthralgic or myalgic problems. So that is why this word exercise in moderation, complete inactivity is not good. At the same time, exercise in moderation. And in the patients with chronic fatigue syndrome, you get back to a graduated exercise under the supervision, under the advice of a physical trainer, physiotherapist, and a medical doctor, or your orthopedic surgeon, that there is no permanent structural damage to your muscles or the joints, and that you can go back to gradual training, and of course, eventually to your pre-COVID or pre-viral, your leisure pursuits and other activities. So exercise is a mainstay. At the same time, it should be a graduated return to the pre-infection level and a bit supervised. And of course, supplement, hydration, another thing. So post-viral illness, including COVID, is known to present only as muscle pain or multiple joint pain. But it is two phases. One is what you experience during the actual acute viral illness. And in most cases, people come out of it in 3 to 4 weeks' time, they're okay. But the same viral illness can also cause what is called post-viral reactive arthralgia or chronic myalgia, which is clubbed together as chronic fatigue syndrome. And that does need a multidisciplinary input and reassurance and gradual return to activities.
Thank you, doctor. So do all cases of COVID-19, do they all have myalgia and muscle aches, or it's not there in all cases?
So what we have from the data now, because now the COVID-19 is almost coming to 2021, half of 2021, now we do have some substantial data from the numbers of cases which has happened across the world and from our own cases that it is roughly predicted to be around average about 20 to 25% can present or can experience muscle pain or joint pain. So and in about 5%, maybe it may be the only symptoms. So overall, if we take the numbers, about 20 to 25%, particularly the middle-age group, can present with muscle pain and joint pain. And as a only symptom of COVID, it can be around 2 to 5%.
But does the COVID-19 also, like we hear about organ damage in some cases where it affects, of course, the lungs, the heart, sometimes myocarditis. Is it known to actually affect the bone and joints? Apart from the viral myalgia, can it also cause actual damage to the bones or the joints?
Yes, again, from the recent reports, because now that we are into more than 18 months, several countries and several institutions have been able to look back at some of their post-COVID patients who have come back with muscle pain and joint pain. And in patients who have come back with joint pain, they've also done various imaging. And in particularly, there is now also evidence that in patients who are already suffering from some kind of arthritic problem with their joints, the inflammatory group, the rheumatoid arthritis group, because the COVID can trigger something like an autoimmune response. Now, some of these are already autoimmune type of diseases which has affected the joints, and they have found that there have been deterioration in the joints which have been already affected. And in patients who have never had previous joint-related problems, also they have seen that the arthritic changes and radiological changes in these patients who are presented with persistent pain in their joints. So yes, it is slowly coming up now that not only muscle pain, post-COVID, like earlier we used to see with other viral infection, has got the potential to aggravate or accelerate the previously existing joint-related problems, as well as cause new onset autoimmune like joint-related disease.
But is that self-limiting? For example, if somebody gets autoimmune arthritis, for example, will that eventually, is it going to be an ongoing thing like a regular arthritis, or is it a self-limiting condition?
In general, once any joint is affected as a process of an autoimmune reaction to the virus, like the degenerative joint disease, the degeneration or the inflammation in the joint is likely to progress. Now, as we treat the rheumatoid arthritis and other inflammatory arthritis, why it is essential to not to ignore this type of pain is if they have a persistent pain, yes, the initial management is going to be analgesics and anti-inflammatory. At a point in time, if it's well into 4 months and 6 months after this COVID, they are having persistent pain, they need to be investigated with imaging, X-rays, and bloods. And these things need to be looked for, whether they have got any of these autoimmune type of arthritis. And if that is the case, the rheumatologist also should be involved. And what treatment we initiate for some of these autoimmune arthritic patients should be initiated to at least halt or slow down the progress of that process. But generally, in medicine, if some joints or musculoskeletal problem is arising out of an autoimmune process, it can recur, it can have intermittent flare-ups, and eventually, yes, it can progress. So to block these intermittent flare-ups, they need to be regularly under follow-ups. If they have a period of completely no pain because they have some treatment, and again the pain comes back, they should visit, and then again we may have to put them back on the drugs.
So for people who have COVID-19 and who are having these muscles ache and body pain and all that, what is the normal treatment, symptomatic treatment that is given? Because we read some news especially in the last year during the first wave, that certain anti-inflammatories should not be given for either COVID-19 or even for any aches and pains, because that can make a non-COVID patient also more vulnerable because of some ACE receptors and all that. So what kind of treatment can be given for joint pain? First, for COVID patients itself, what is the treatment? And then what is the role of certain pain medications not supposed to be given, or anti-inflammatory medications not supposed to be given even for other patients who don't have COVID but still have their usual joint pains and muscle pain?
Yes, in general, any viral myalgia or arthritic pain, whenever we are called to see, sometimes we have to see them whilst they are still in the hospital, even before they got discharged. Sometimes they come back to the outpatients follow-up. We tend to, the simple, of course, first is assessment, and then if there is no actual focal tenderness in the joint, there is no focal tenderness in the muscle, is rather general ache, something like acetaminophen is best on the cards, which is paracetamol. Of course, you have to use the right dosage of so many milligrams per kilogram body weight and not go less on the dose. Now that's a common error, which is to use half the dose, which is actually that patient should be taken. Acetaminophen in the actual required dose for that person actually is a very good analgesic, and every 6 hourly or 8 hourly. And of course, in the acute phase, we encourage and focus more on the hydration. And if the patient is immobile, they're actually in the critical care ward or in the post-critical care ward, to at least passively move the joints and exercise the joints and not let them stiffen up. Now, the issue with anti-inflammatory is whether it will suppress the immune system. The other thing is in regard to whether it will interact with the ACE2 inhibitors, which is where the SARS-CoV-2 supposed to attach itself and enter the endothelial membrane. Now, having said that, because some of these patients are also requiring steroids for when they go into hypoxia, the steroid will also take care of the anti-inflammatory role. Now, in the non-COVID, why they say don't give the steroids or any of these anti-inflammatories, whether it will dampen the immune system and thereby putting the patient's immune system less capable to fight against this virus. So we tend to go largely with acetaminophen and then hydration, passive or active exercise or mobilization of the joints. If in addition is required, we then go to something like opioid based. Now, if we know there is an inflammation, a single joint is warm, swollen, red, there is inflammation, then there is no harm in using the anti-inflammatories, and certainly the likes of ibuprofen are more safer.
Also, when somebody you spoke about acetaminophen and paracetamol and also the hydration, what else? Are there any other home remedies that mild COVID patients with body pain can do to get themselves relieved, at least for the acute phase of the viral infection?
We do use the external therapy if it's focused to a particular joint or a particular area. Cold fomentation, if it's warm, and of course, if they have access to physiotherapy, we use some of the modalities of physiotherapy also, like ultrasound or IFT, we can use. But if it's rather generalized ache, apart from the acetaminophen, we do initiate the anti-inflammatory also. And the opioid based, like tramadol, they're also safe. Particularly if the patient is not hypoxic or already the conscious level is low, again, opioid-based analgesics like tramadol can be used.
So the best thing is for them to contact their consultant and get the proper appropriate treatment for the pain.
Yes, with the teleconsultation. So some of these are sometimes teleconsultation or over the phone, and where you're able to do a limited examination of them, but able to understand their pain. The first line we start is to emphasize on the hydration, nice deep breathing exercises, activity in moderation, not complete rest, but keep going, and start the proper dose of acetaminophen. Now, in cases where they're not hypoxic, they're otherwise fine, only body pain and myalgic pain and or joint pain, we then introduce the anti-inflammatories such as the ibuprofen group of drugs can be used. Because by that time, they're already into the 4th day, 5th day.
The next group of patients are those, as we said, already with some orthopedic problem or joint pain. Will that all, you said that it can get worse and there will be more, they can have more symptoms, even those with rheumatoid arthritis. So are they likely to be having also more of the COVID complications also apart from the increased pain? Are they likely to also suffer from more organ damage or might need to get hospitalized, or there's no such data to say that people with existing musculoskeletal problems are also like the comorbids and they're likely to have severe disease?
Now, the full data following COVID in terms of what percentage of these people of rheumatoid can experience a flare-up of the symptoms is not known yet. Early data suggests, yes, they could be prone for a flare-up of their joint-related problems. So if they're already seeing a rheumatologists or they're already on some rheumatoid medication, they should continue it. They may have temporarily discontinued in case they have been hospitalized. Some of their medication may have been stopped. But once they're recovered from the COVID, in terms of their hypoxia and their general health, they should restart their medications for what they've been taking for their rheumatoid illness or other inflammatory arthritis. And of course, consultations are available, both physical and teleconsultations are available. After a brief chat with their treating doctor, they should restart, because it is better to go back on the medication they were on to prevent this problem of flare-ups if they leave it, if they go without the medication for long run, because they're already prone for flare-ups, and post-viral the chances are more. If it's a nuance also, they should do the same thing. The joint pain is not settling, it's a recurring joint pain. They will be investigated and tested for whether they have turned into one of these autoimmune type of arthritic problems. But they should go back on the medication they've been taking. Yes, from other viral related illness, we know that post-viral, there is a chance of flare-up of these kind of arthritic problems. And from the early reports available post-COVID now, there are early reports to suggest, yes, they are potentially, they can have flare-ups of their pre-existing problems. They should be under follow-up.
Yeah, because we have heard of people who, because they're scared to take their anti-inflammatory or their immunosuppressant medication given for their autoimmune arthritis, because they're scared that they will get COVID and then they end up with flare-ups. So I think the message would be that they should talk to their rheumatologist before taking any such decisions on their own.
Yeah, particularly there could be patients who are on methotrexate, and because COVID is primarily a lung-related problem, and with methotrexate, there's always some concern of lung diseases. Definitely, those patients, their methotrexate would have been stopped at the time of hospitalization, or during the acute COVID time, they would have been advised to stop it. But once their general condition improves and they're not hypoxic and their general condition is better, they should take consultation and see what's the appropriate time to restart those methotrexate. And also, if they have been on steroids. The disease-modifying DMRD drugs, some of them may have been having it on a regular basis, or they may have been advised one of these drugs. That also you need to give at least 2 to 3 months, and ideally not to start it before 3 months if you're recovering from COVID.
What about the people who are not having COVID, but then a lot of them are now not taking up their follow-up care, or if they have been advised physiotherapy, maybe they're not coming to the hospital for that. Some of them might have been told that they need surgery or maybe a joint replacement. So what advice do you have for such people? Do you think they should just wait for some time? Because we keep getting these lockdowns and waves after waves. So, now everything needs to be timed also according to how these pandemic waves are happening. So what do you advise? Do you think they should just wait, or are they advised? For example, in Apollo, we have an excellent segregation and an infection control protocol. So I wouldn't think it's a big safety risk, but what is your advice?
Yeah, that's a very interesting topic, because there are two aspects to it. One is how disabling the problem to that patient. And in our own experience over the past few months, same time last year, there are two categories of patients where we continued our services. One is the patients who are coming with fractures because of injuries at home, or whatever little traffic was there. There were some one or two accidents, and those patients have to be operated because their fractures were quite bad. And we took and fortunately, yes, like you said, at Apollo, the ID protocol was periodically reviewed and guidance was given as to how to go about admitting these patients and how to take care of these patients during the inpatient stay. So yes, we They all had their COVID tested. The team got tested periodically, and there was a segregation of the separate wards for this. And I can say that we did not have any adverse problems in terms of undertaking those cases of fractures during the period. Yes, some of them were positive, and we had to do the theatre allocated for those kind of patients with all the PPEs for the person involved, and they were put in an isolation place, and they were attended to by the nurses and the physios, and they were recovered well at home. Until follow-up, they have not had any after effects of having had the surgery because of the fracture. Now, the other group of patients also, some of them willingly came forward because their symptoms of the pre-existing arthritis in the knee or hip, where they were almost about to get their surgery done at the beginning of 2019 or middle of 2019. They waited for 2-3 months, but come post June or August, they felt probably it was the right time to get it done, because once everything opened up, it will be unfair on the part to go back and ask the employers for leave, extended leave at that time. So they approached and asked whether it is safe to get the surgery done, because the pain has become severe and is affecting their day-to-day activity. And now they're mostly indoors, they're not able to do any of the physical activity, they're gaining weight, the joint is getting more stiff. So we have performed elective joint replacement also. What the advantage we had is definitely they were screened. In cases where they were positive, as per the guidance existing at the time, they were asked to wait for 2 to 3 weeks, and where situation permitted, even longer, 6 weeks plus. We wait, and then we perform the joint replacement on them, and they're all doing well. So it is safe to perform surgery in this situation also, because we have separate centers, separate wards, separate theaters to handle these patients. Our rehabilitation services continued all throughout. So post-surgery, perioperative and post-surgery rehabilitation also continued. And for some of these elective procedures, the patient's perception was that it will be they're having a break of 3 to 4 months or even an indefinite break. So why not I get it done? Let me get recovered. So in case when the company or office opens in full swing, they're ready to go back in. So yes, it is safe because protocols are in place. But if it's not urgent, if it can be avoided, it was avoided.
Doctor, now we will take some questions that are coming in live from our viewers. So I'll read them out one by one. Post-COVID, my legs are numb, pins and needles, and unable to walk. Are there any suggestions from you?
Yes, these type of symptoms also comes under this cluster of post-COVID chronic fatigue syndrome, because the reactive, as we call the post-viral reactive arthralgia, it can also cause same kind of inflammation in the muscles. It can also cause similar inflammation in the nerves also. So this could be a combination of muscles and nerves, because pins and needles and paresthesia generally means there is some neural inflammation is there in someone who's not had it pre-existing. Now, there are a few things, which is how long since COVID. Number two, if there is diabetes, then the chances are more that there is some peripheral neuropathy, because the diabetic patients are prone for peripheral neuropathy even before, and post-viral, it must have accelerated the process. And is it focal or is it rather diffuse? Because if it is in only one hand or one feet, we also have to look for any local compressive symptoms, signs. It could be that part of the hand or that part of the feet is swollen, and that swelling is putting pressure on the nerves. Now, one is to take general medications which you prescribe for chronic neuritic pain, and also two is to get evaluated by physical examination and also nerve conduction study. But if it's beyond 6 weeks or 2 months since the COVID, I would suggest an evaluation will be better.
I am getting joint pains after I got the first dose of Covishield vaccination. Is it expected, or do I need to take a COVID test or consult a doctor?
Post any vaccination, one of the after effects it could be is joint pain and muscle pain after any vaccine, from our measles, chicken pox to the current COVID vaccine. And all the brands of vaccine also is known to cause this. It is there, a flu-like symptoms, we say, whenever these jabs are given, that you can experience fever or warmth, a bit of a tiredness, and muscle ache and joint ache. But generally, these disappear in 2 to 3 days, a max of about 4 days. They do gradually wean out. And of course, it is not no harm in taking paracetamol. You would be advised post-vaccination, also at the vaccination center, you can take a paracetamol if you're experiencing any pain. Post-vaccination muscle and joint pain is not expected to last longer than that. If you've already had a pre-existing joint issue, maybe it could have caused a flare-up. Even that should settle. But the after effect of vaccination on the joint muscle is not long-lasting. So if you're still continuing to have it, and for a best case scenario that you've left it even for a week, I think best is to consult and take an advice.
Is it true that if we exercise regularly and keep our muscles fit and good, that in advancing age we will have less of joint pain?
Certainly, yes. In terms of what's called the bone density, that is the bone mass, it is supposed to peak at around 35 to 40. And it starts gradually declining, and certainly more rapidly in women postmenopausal, and slightly at a later age in men, and leading to what is called osteoporosis. So an active lifestyle and regular exercises in your adolescent and your middle age group helps to certainly improve this bone mass or bone density. So that when the decline happens, you have a large reserve. It will take many years to bring it down to a very critical level. A bone which is completely rested with activity can go to disuse osteoporosis. So the muscle activity actually strengthens the bone as well by increasing its density. But what we find sometimes is during this pandemic also, and even otherwise pandemic, is there's sometimes over enthusiasm in doing these exercises because you're in the lockdown, and then the gyms were, the spas and gyms were open. People are allowed to go out. They start cycling, and because for 3-4 months they didn't do anything. Some of these people who actually never done any exercises, or people who have already been doing regular exercises, they increase the intensity in the short time. Now, overuse injuries, are also common. We do see it sometimes when they come with muscle and joint pain. Some of these are related to over exercises or overuse injury. Particularly if you're recovering from COVID and you started exercising because you have this fatigue and lethargy and tiredness, please go on a graduate increase in the exercise program. Don't suddenly jump into a very high level intense activity.
Right. Next question is about are there any constraints or restrictions for climbing staircases? I assume during COVID-19, doesn't say what it is.
Can I just ask for a repeat of that? You broke in between.
Are there any constraints or restrictions in climbing stairs? I assume during COVID-19 infection, I think they don't mention that.
Well, yeah. Well, not restriction. I think it depends on your physical state, general physical health, and everything. Because if this is in relation to you're quarantined at home because of COVID, or you're just recovering from COVID, as I mentioned earlier, excessive activity beyond what your muscle can tolerate, because it's recovering, can tilt the metabolism from an aerobic to anaerobic. So if you are experiencing some breathlessness and your oxygen saturation is not come back to fully normal, that is 96 or 98, which is what is normal for you, it is better to avoid climbing frequently. And if you're already known to have some knee joint related problem or ankle related problem, again, you may aggravate the pain of that particular joint. And climbing stairs up and down is not necessarily a very exercise of necessity. It doesn't improve your endurance or anything. To improve your endurance, you can always walk around the building, treadmill in moderation, and this climbing down up and down the stairs, if you already have a joint issues, can aggravate your joint issues, or if you're recovering from hypoxia from COVID, yes, better to avoid too frequently.
I had neck pain leading to back of brainstem giving severe headache and observed nerve knots on vagus nerve and collar bones on either side of the neck below the ear. Started with the lockdown and I'm taking Mobisox tablets almost every day. Please advise.
Yes, some of these we have handled through teleconsultation, and what we have found is during lockdown and even now, almost most companies have made it as work from home. This seems to be working well for them, and this particular scenario may be related to something like that, where someone is on the system and working from home, and in fact, some of them are claiming that they are actually working more hours than actually when they work from the office. So it may be long hours of sitting before a system in this particular case, maybe. And so Mobisox, taking it regularly is not advisable. One, when you take it, if it's helping you, okay, you can take it for some time, but not indefinitely. You're also experiencing symptoms of what we call radiation pain, that it is going to upper back and sometimes to the back of the head and sometimes to the upper shoulder. You're describing some kind of a cervical disc protrusion or disc bulge with some nerve irritation. So I would advise that you can at least take first a teleconsultation. If you're afraid to come for a physical consultations are open in designated buildings, or otherwise at least a teleconsultation where you'll be able to address it better. And maybe we may need to do some investigations because Mobisox does contain anti-inflammatory and can have renal and gastric side effects.
Hello, doctor. I've completed 1 month after testing positive. I got some pain in the chest, mostly on the right side. Once in a while, it disappears, and sometimes a numbness on my left hand and leg. No other symptoms. Is it a cause of concern? But I also had this kind of numbness due to neck-related issues last year, which was treated already by an orthopedic specialist.
Yeah, two things. One is your right-sided chest pain. It could be a pleuritic pain where if your lungs were involved by COVID, and as we know, COVID causes fibrosis and takes a while to recover, and you can get intermittent pain in the chest region. If the pain also correlates with any focal tenderness on the ribs, particularly more close towards the midline, it could be what we call as costochondritis and inflammation of the joints of the ribs, which can happen post any viral illness. Take simple analgesics, and if the chest symptoms are intermittent, it could be possible, as I told you, maybe a pleuritic type of pain. The second issue, as you mentioned, you have had this neck-related issue in the past, and I think maybe immobilization or static posture may once again trigger a neck issue to flare up, and it needs to be addressed again by, of course, symptomatic medication to relieve your pain. Two is also initiate physiotherapy, or if you know some of the exercises you have done in your last consultation, and I'm sure how you got out of it would have been a combination of medication and physiotherapy. You can do it at self at home, restart those neck isometric exercises, shoulder exercises, and see how it goes. If not, we can certainly be happy to help you by with a consultation.
Another person has asked whether a pain in calf and ankle during night time, who should they have to consult?
It could be intermittent, and there have been patients who complained of cramp-like pain in the muscles of the calf, in the calf region. A cramp-like pain is intermittent. They have to roll in bed, and then they get up, they shake, and then when they go back, it's better. And the other thing, a fully radiating pain from the low back, along the thigh, in the calf, and the foot. So if it's isolated in the calf, it's intermittent, more like a muscle twitching, a cramp. After a teleconsultation with one of us, we can probably start you on some medication which can address the cramps. Make sure you're okay with the vitamin D. Sometimes vitamin D helps, vitamin D supplements, and then see how it goes. And if it persists, then we may have to check the circulation in the legs. Now, as long as it's a pain, and if you've not noticed any swelling in the calf, particularly any tight swelling in the calf, and it's not tender to touch, we don't have to worry about what we call deep vein thrombosis. As we know, one of the concerns of COVID illness is that it is prone to, or it can cause thrombotic events, and that's why strokes are happening. That's why sometimes we also see deep vein thrombosis, which means actually thrombosis of the veins, the legs. But deep vein thrombosis will be a more intense pain. There will be swelling, a very tight swelling, and it's quite tender to touch. So if none of those is there, it is only an internal cramp-like pain, and then yes, you can wait, and we can certainly do it for a teleconsultation and initiate you on some medication. If it's swollen, tense, and tender, then you do need to get an urgent scan of the leg to rule out a deep vein thrombosis.
So thank you, doctor, for this very extensive discussion. And I think our viewers have now much more clearer on the differentiation between aches and pains and how to deal with them during this COVID-19 pandemic. Thank you, viewers, and we will be meeting tomorrow at the same time. The topic would be, can obesity be a risk for severe COVID-19 infection? And this is going to be discussed by Dr. Arun Prasad, Senior Consultant, Apollo Hospitals, New Delhi. Meanwhile, I hope that you will stay safe. I hope you haven't forgotten SMS, which is the social distancing, wearing the mask, and sanitizing as often as possible. And of course, getting vaccinated once your turn comes. Stay safe and do not hesitate to reach out to us at Apollo for any COVID-related care and support. We have the project Kavach, which is like a 360-degree holistic management of every aspect of COVID, right from video consultations to care while you're isolating at home or hospital admission, and of course, expert COVID care for severe COVID disease. Thank you so much, and namaste.
Thank you.